back to the pandemic, which has hit crisis levels in America's heartland. One hospital in Topeka, Kansas, has had to turn its waiting room into a hospital room for those without COVID because the ER is just too full. Our lead national correspondent, that's David Begnaud, is in Fargo, North Dakota. David, good morning to you. That state, we're told, just hit another daily high in COVID deaths. The numbers tell the story here.
Gail, it is so bad. The Dakotas, both north and south, lead the world. They lead the world right now on a per capita basis when it comes to the number of people who are dying on a daily basis. And look, politics has affected so much of what's happening here. I mean, people will fight you on the facts. And if you were to ask, hey, how's North Dakota handling the pandemic? Watch.
If you were grading it, it would be an F, probably an F minus. It's that bad.
Joel Heitkamp hosts the #1 talk radio program in North Dakota. The former Democratic state senator takes tons of calls about COVID every day in a largely Republican state.
And you have a right to call into this show anytime you want.
Well, the height of hypocrisy in North Dakota right now is how we care for our elderly. If you go into Costco, you go into Walmart, you go into any of these places, they say put your blank mask on, you're going to put it on. But you know what? They're not willing to do that around Grandpa and Grandma after they've been out in the bar. And I can't figure it out.
Just yesterday, North Dakota reported 37 new COVID-related deaths. That is a new high. They have the second highest mortality rate in the world, and some of their hospitals are overwhelmed. That's why the U.S. Air Force has sent 60 nurses to help staff hospitals around the state. In South Dakota, the debate over wearing a mask continues statewide.
I think if we choose to wear it for our own protection, that's on us. But to force us to wear it, you know, like, I'm against that.
Around 50% of South Dakotans say they do not wear a mask. Kelby Krabenhoff, CEO of Sanford Health, the largest health system in the Dakotas, suddenly retired last night after creating a firestorm this week by saying he wasn't going to wear his mask at work because he had recovered from the coronavirus and was immune. Now, in a statement, his own health system said they had mutually agreed to part ways and that his views didn't reflect those of the company. He also downplayed the seriousness of the pandemic to our Sioux Falls CBS affiliate, Kelloland.
It's hard for me to say we are at a crisis. That would be misleading from a clinical standpoint.
He is not a doctor, but his chief medical officer, Allison Suttle, is. I asked her.
Would you classify what is happening here in the Dakotas as a crisis?
I would.
36 hours after she contradicted her CEO on CBS this morning, he is gone. Dr. Suttle is also calling on South Dakota's Republican Governor, Kristi Noem, to mandate masks statewide. But the governor refuses to. North Dakota's Republican Governor, Gov Burgum, did that 2 weeks ago.
How much is Trump's messaging affecting local politics here in North Dakota?
It affects everything here in North Dakota. If he tells a lot of these folks that the science doesn't back it up, or that you can shove a light bulb up your keister and it's all going to make things better, some people here are going to believe it.
And he hears from people every day on his radio show. Let me tell you one quick story. Yankton, South Dakota, small town in the southern part of the state. The commission met to talk about mask mandates, and they decided no. The local newspaper said the commission wants more time to educate people. Here's a reasonable question. We're 8 months into a pandemic. How much more time do you need? How much more time do you need to educate people about it?
Yeah, exactly,
Anthony?
David. Thank you. And
Exactly.
please don't shove a light bulb up your keister.
And you said that with a straight face. I was thinking that too. But
All right.
you do have to say that, Anthony,
Yeah.
because people are paying attention in different ways.
Yes, they are.